so now question, how does Tylenol actually work in the body? Unlike ibuprofen or aspirin, Tylenol is not an anti-inflammatory medicine. Instead, it works mainly in the brain and spinal cord. It blocks certain chemical signals that makes us feel pain, and it lowers fever by acting on the part of the brain that controls body temperature. And that's why Tylenol is great for headaches, fevers, and mild pain, but not as helpful for swelling or arthritis. It is also easier on the stomach than many other painkillers. Before we talk about side effects, let's start with the basics. How much Tylenol should you actually take? So the recommendations that are actually printed on every Tylenol bottle are the following. And before I go into that, I have to say, so the dosages that I'm gonna talk about are for adults. For children, the dose is always calculated based on their weight, which is why children's Tylenol products come with dosing charts and usually syringes. So now back to adults. So regular strength Tylenol for adults. So each pill has 325 milligrams of acetaminophen, and the recommended dose is 1 to 2 tablets every 4 to 6 hours as needed. So do not take more than 10 pills, 10 tablets in 24 hours. And that equals 3,250 milligrams per day. Now let's switch to extra strength Tylenol. And again, we're talking about adults. So each pill has 500 milligrams of acetaminophen. The recommended dose is 1 pill every 6 hours as needed. Do not take more than 6 pills in 24 hours. That equals a maximum of 3,000 milligrams per day. So now, what about side effects? Most people actually think that Tylenol is completely harmless, but that's not true. Like any medicine, it has possible side effects, and some of the most common include nausea and upset stomach, loss of appetite. Also, people could develop itching or skin rash, but that's not really that common. But the biggest danger for people who take a lot of Tylenol is, of course, liver damage. So why is the liver at risk? When the liver processes acetaminophen, most of it is broken down safely, but a small portion is turned into a toxic byproduct called NAPQI. Normally, your body neutralizes this NAPQI, but if you take too much Tylenol, your body can't keep up. The NAPQI builds up and the liver cells start to die. And that's why overdoses can lead to acute liver failure, sometimes within just a few days.